participants to please keep their camera off and audio on mute. For any questions and queries, please write in the chat box. We will be taking the questions in between the session and lately at the last of the session. We will also be giving the recording of the session to all our registered participants. Thank you. Now I hand over it to Meha. Over to you, Meha.
Thank you, Anshu. It is my absolute honor and pleasure to welcome Dr. Ravikant Singh. Dr. Ravikant heads Doctors for You, which is established in 2007. Sir is an MBBS doctor with an MD from GSMC and KEM Hospital, Mumbai. He's a public health professional with specialization in emergency preparedness and response. He's also the first and only Indian who has received the SAARC Youth Award for outstanding work done in aftermath of natural disaster. We are pleased to announce that today we are going to have a session on field operations during COVID-19, the house of it for frontline workers. So basically what we discussed today is that when we are working with frontline workers or when we ourselves are going out into the field during the COVID-19, because this is here to stay, what are the precautions that we are supposed to take when during the field operations? Also, sir will talk a little about what is coronavirus, why is it so deadly, and why is it so dangerous? Over to you, sir.
Thank you, Meha, and thank you all at HCL Foundation for inviting me for this talk. And as you know, nowadays lots of webinar are going on. So there are many jokes also circulating on WhatsApp regarding too many killed by webinar. So I will promise that I will not share too much information or thing. Just I will share only practical and very important thing, especially for the field worker. And to start with, the first thing I wanted to convey that we are working extensively in Mumbai, and currently around 8 of our staff are also, like 6 are confirmed corona positive and a few are suspected. So we are actually facing this challenge. So I will share some of my practical experience which we have faced in last few weeks, and I hope it will be very helpful for everyone, those who are working on ground. So may I request Meha to go to the next slide. Yeah, so start with the basic. So till now, whatever the image you are seeing of corona, it's all graphic images. So this is the picture of actual corona virus. So so first we have to understand that why this is so dangerous compared to other viruses. So so this virus is unique, and in fact just 2 days back ICMR has said that this virus has like transmitted from bats to some other mammal and then to animal. This kind of transmission and the virus which is like transmitting from human to human, it happened probably in once in a 1000 years. So this is very unique feature of corona. And if you see, the virus are actually not even living organism. It's you can say it's a inert outside the cell or outside of the body. So if you see the graphic image of corona, Meha, shift to the next slide. You will see it has one the central core where this chain-like structure is basically RNA. So it's a single-stranded RNA, which is actually dangerous. If this RNA goes inside our cell, it's start replicating and creating all sorts of problem. But I'm showing this image just to understand that. See the outer picture of this virus. The outer layer of this virus is made of lipids. And as you know, lipids like oil, fat, all these things. So, using soap and detergent is going to dissolve the lipid layer or clean our clothes. So, similarly, by that principle, this coronavirus, once we wash our hand with soap or any liquid, it immediately destroyed the outer layer of virus, and virus became non-infective. So that's why everybody is promoting wash, because washing your hand is the most important thing which you can do to prevent corona. So this is the first important. The second important thing is corona has to go inside our cell to create any illness or sickness. And our body, if you see, the only these three things, eye, nose, and oral mucosa, these three openings have like mucosal lining, from where a virus get the entry inside the cell. So if we use the mask and the glasses, we will protect all this. So that's why we use these masks we use this mask to cover our nose and mouth. So covering nose and mouth is very important, because this is the main source of entry of this virus inside our body. And the third one is not that significant, is through eyes. So those who are wearing glasses are automatically like little bit protected with this virus. But so the two things, this mask and your hand, is the most important thing which can prevent you from this deadly virus, as well as if you don't use these two things correctly, it can predispose you to further infection. Moving to next slide. So uh, yeah. So why this virus is so deadly? So there is a saying in epidemiology that virus anywhere is virus everywhere. So and that's why we have to target total eradication of corona. That is our like wish to totally eradicate this. There is a one study which found that any viral diseases nowadays, when the air traffic is so high, can transmit from one country to any other country in the world just 36 hours. Just 36 hours. So that's why it's very important for all of us, not just in India, but globally, to eliminate this virus or eradicate this virus. Otherwise it can spread again, or there will be waves of second, third, fourth wave if we don't eliminate it completely. This also you have to understand. Many people are saying, oh, let's my state Kerala is safe, so don't worry about other. It's not like that. Kerala is safe, but again the people coming from different states can again create a chain of reaction. In fact, you must be hearing since last 3-4 days in Wuhan, which was once totally clear, is again cases are coming up. So these cases are might be coming from other places in China or outside China. So that's why we have to target total elimination of this virus. Next slide. So as I said, so these are the three modes of transmission. The earlier we used to say that the 3 meter minimum 3 feet distance. But there are some evidence it suggests that we should maintain, if possible, up to 6 feet is best, but minimum 3 feet distance is very important to maintain between two individual. And you can see once we cough or sneeze, it can transmit through our cough through our breath or through contact, and this contact is very important. So if somebody has touched any metal surface or the handle of the door, it can transmit through that also. I think about this, most of the people know too much on the modes of transmission. So we can shift to the next slide. So yes, you must have seen like there are lots of prediction predicted by many mathematical models, and many people say, "Ki, oh, this is not correct," or this is prediction but not happen. So basically, it's a very complicated thing. The biology is not the function like mathematics that 2 plus 2 is 4. Here 2 plus 2 can become 0 also. So like our scientists or epidemiologists, they have predicted. But right now what is happening, we are not testing everyone. If you see even in Mumbai or other places where we have lots of resources, there also government is struggling to test everyone. And if you don't test, then you will not get the number. Once you test, then only you will get to know the exactly. So ideally, everybody should be tested in a particular block or district to declare that, oh, this is the caseload of my block or district. But right now we are not doing. So in fact, for our staff, we are not able to get testing kit. So they are positive, but their number is not counted in the official figure. So similarly, there are lots of asymptomatic cases. Most of the children are like asymptomatic only, and they spread the virus. So lots of healthy individual children, they are asymptomatic. They don't have any symptom or just minimal symptom, which they ignore that it's not like normal flu, but that might be corona. So I'm still skeptical that these predictions are totally wrong. Maybe in different countries there are different strains of viruses, so it might be little higher or lower. But the whatever figure currently we are seeing in any country, either in India, US, or China, actual number is at least 4 to 5 times more than that. And this is very very important to understand, that we calculate mortality rate with all only confirmed cases, not the all those people who are not even get tested. So actually, if you ask me, the mortality rate is much lower, but we are testing limited number, so that's why mortality rate varies from 3% to 5% in most of the places. If you see like West Bengal, mortality rate at one point of the time 12%. So it's not true, because as it was 12% few days back, but if you see today or maybe after 2 weeks, mortality rate again goes down, because by that time state must have tested lot many people. So don't worry too much about the mortality rate. Just focus on safety of yourself and your staff. The only thing universal is corona. So कोरोना इज गोइंग टू स्टे. बहुत सारे लोग जो थे वो इस उम्मीद में थे कि यस दिस विल गो अवे इन 2-3 weeks or 2-3 months. बट यू सी लॉकडाउन 1 के पहले भी देयर वाज 1 day जनता कर्फ्यू, देन लॉकडाउन 1, 2, 3, एंड नाउ वी आर प्रिपेयरिंग फॉर 4 lockdown. So most probably, and the most recently WHO in a press conference yesterday, they have said this might be this virus might continue for much longer period. And those who are in like euphoria that once we get the vaccine, we will totally eradicate corona just like a smallpox. So I'll give you few example. We have very good vaccine for measles, very good for diphtheria, pertussis, tetanus. What are we able to eliminate measles so far? No. Even polio, for your information, is not eradicated globally. In Pakistan and Afghanistan, polio is still present in spite of one of the best vaccines available for that. So what I'm trying to say that we should change our mindset from very afraid of corona to try to adjust our working culture, behavior, and try to target over next few weeks to few months period, adjust all our program activity, our household activity, our office activity, modified in a way that corona rahe na rahe, but we should continue working. Otherwise, we will get much more affected because of non-COVID related things than by COVID. Next slide. So typically, if you see any, so right now you see the Maharashtra is in the very red zone. We have like out of 25,000 cases in the Maharashtra, Mumbai only has more than 15 to 17,000 cases. So typically during Spanish flu also, the virus first came to this the Maharashtra, Mumbai, and then it spread to downside toward the south and towards the west. So with Corona also we are seeing the same thing. The first this Mumbai got affected, and then now if you see with the movement of the migrant and other people, the western part of the country is going to get affected more gradually. So the graph is shifting from the western side to the eastern side of India. So probably in next 2 to 3 month period, we will see lots of cases in rural areas of Bihar, Bengal, and as well as the cities of our western states. Next slide. Currently, hardly any state is left. I think only Sikkim, they have not reported any case. Otherwise, most of the states are affected with. So this is another graph. This was also very older prediction, but just to show you that if the doubling rate is 3 day, then by 28th April, our bed would have been like totally finished. But currently our doubling rate is, I think, more than 10 days, 10 or 11 days. So probably with this speed, there is one prediction that by 15th August, Independence Day, we will run out of all our beds available in public hospitals in India. Next. And that's why the government is now roping in lots of other partners and segregating cases. Only sick cases, sick or critical cases, they are taking to the higher center. Otherwise, all mild, moderate, or asymptomatic cases should be managed at the isolation or quarantine center only. Usually, quarantine center only for the contact, but now because the caseload is increasing, so whatever facility available, we are using that. There is, I also wanted to suggest the one important evidence that there was one study where they have, so in Wuhan, they have shifted all the patients to the hospital, while in European country, they have kept this, they have followed home isolation model. And they found that Wuhan is out, like totally clear of corona, and European countries are still struggling. So even if you ask me, I would also suggest, if possible, we should keep all cases, confirmed cases of or asymptomatic but confirmed cases of corona also in the hospital or institutional setup, not mix it with the general public. Otherwise, almost 80% of the cases so far are because of the home transmission or through public transport system, not like normal community transmission. So now how to prevent is wash your hand as frequently as possible. So in fact, at your workplace, if you are working in a office, there is a one, like somebody, if you have like common announcement system, then maybe every 1 hourly you can announce like time check and appeal everyone to wash your hand. That can be done. Like suppose right now it's 3 o'clock, then it's 3 o'clock and please wash your hand. This message you can, this will bring some behavioral change. Wash your hand properly with all the step minimum for 15 to 20 second. 20 second is the minimum recommended. Maintain social distancing everywhere, not just in the office but outside, on the field. Even when you are doing the distribution, plan it properly, give proper time on planning. Just taking some item for distribution on and going on field will create big chaos, and put your and your team into danger. In fact, we were providing PPE kit, but still our staff got affected. So infected. So I asked my team why this happened. Then they said, "Sir, because of this hot summer, they were wearing this PPE kit, and many of our staff are on roja, so day-long fast. So many of our staff, what they did, they removed the mask and drink the water, and that's why probably they got infected. So now we have decided to reduce the timing, and we have given clear instruction. If you are going on field, drink, eat before going to the field, and use washroom also, so that you should not need to go for at least 3-4 hours. So this instruction is especially for those staff who are wearing PEP, but for others also, maintaining social distancing and wearing mask is very important. Practice respiratory hygiene. You all know that stuff in your hand. The fourth thing is very important: seek medical care early. So don't wait. If you have even slightest chance like headache, fever, immediately report the symptom and stay at your home. That is very, if you don't tell and just join the work, you are going to infect your other colleagues. So it's very important to, in fact, diarrhea is also is one of the signs of coronavirus. So you report it immediately. Then use of mask and gloves. Those who are actively on field, and they are like giving something or noting down something, they should use mask and gloves. Best thing is no touch delivery or no touch technique. I saw many, like when all this started, that many NGO staff, they were taking pictures with the beneficiary and other, and they're touching hand. So that is very wrong. You should, those who are involved in food distribution, they should use the gloves, keep the material at one place, and let the other the beneficiary take away. There should be no handshake or touch between the person who is handling over these material. Plus, here only I want to mention that the disinfectant of your office premises is also very important. Plus, the vehicle you are using, you can use simple hypochlorite solution to clean all the surface, and to fumigate also. But the cleaning of all the surfaces like the floor, the table, any other material is very important. If you can do it daily, that is the best. Otherwise, every second or third day, you should disinfect your office premises. The another very important thing: train your staff for self monitoring of the signs of illness. that what are the signs of, so your every staff, right from your sweeper to your higher up manager, they should know the signs and symptoms of corona. Plus, uh, unless until you will appoint somebody to look after all these things. So what we now did is we have appointed one person as infection prevention control IPC in charge, or infection supervisor, infection control supervisor. Because unless until you give a specific task to somebody, nobody is going to bother, because we think that we will take the training and everything, from next day they will start follow, but it did not happen. So you appoint one person and appoint as a infection control supervisor, and he or she should see that all the staff from the higher up to bottom down, everybody should follow the proper rules and regulations set by the your organization for infection control. In fact, in my clinic, I have given this thermal gun to my door keeper. So this is very cheap, 4,000, 4,500. You will get this infrared thermometer. So actually this is used for two things: to measure the body temperature as well as measure the temperature of any surface, any metal surface or table. So you have to adjust it for the human or body. And one major mistake everybody is doing, you must be saying many picture, they use it like a gun, but 3 feet 4 feet se jo hai na, they fire. It's not. So ideally this distance should be not more than 3 to 5 centimeter. And so this is the right way to measure, not like this with 1 feet or 2 feet away. You won't have to touch this, but agar touch ho jata hai, you can clean it with spirit or hand sanitizer. But now whenever you are using this, you use this for just 3 to 5 centimeter distance. Another way, which another more sophisticated way to test is use of pulse oximeter. Pulse oximeter, you must have seen, it also comes in around 1800 to 2000 rupees. So if you suspect that any person is sick, and so if the SpO2, it can oxygen saturation, SpO2 level. So if SpO2 level is less than 96, then the chances of that person having some respiratory illness, not necessary corona, is high. So these two things, if you use, it's wonderful. Otherwise, just the thermal screening of all the staff daily is a very good idea. At least this time when the corona cases or circulation is very high. And you please note down that the situation which we are facing in Mumbai or any city with densely populated slum, every city has to go through the same cycle. So don't think that Calcutta will not face situation like Mumbai, or Patna will not face. Like if there are like the densely populated slum, corona is going to create same problem that we are facing in uh, Mumbai. The next slide. So yes, the next thing is a mask. So as you most of you are aware, this is like type of N95 mask. Now, to original N95 is of 3M company, which is very costly, out of stock. We are not getting. So there are lots of versions of N95 mask. So we are using this, but this is only for the health worker, especially doctor and nurses. For other staff, even simple mask is fine, all medical staff. But for the non-medical people who are involved in just for the normal people, even cloth mask is sufficient, but there should be four layers of, not just one. ऐसा नहीं कि just रुमाल रख लिया और हो गया. It should be like 4-layer cloth mask. Then only it provides some significant protection. Otherwise, the cloth mask won't prevent. And also, cloth mask is not for your protection, it is for your family protection. So suppose if you have symptom, if you don't use even cloth mask, and if you cough and sneeze, then your family member, your colleague will also get infected. So for general public, cloth mask. For those who are on field and especially working in the district where the caseload of corona is very high or currently in high circulation phase, then I would suggest surgical mask, use of surgical mask. One mask is sufficient. If you are too afraid, you can use two masks, but not more than two cover. And gloves also, you can use simple non-sterile examination gloves you can use. And whenever if there is any spill or any doubt, you can change the outer layer and you can use the second layer. For you can wear the second one, but this is only for those who are actually very close to the beneficiary, not for everyone or doing some administration. During the distribution, crowd management is also important. So you allot at least one person to manage the crowd and maintain that social distancing. Otherwise, it will create problem. Plus, the timing of distribution is also important. It's not necessary that you distribute or do your work at one go only. So probably you can divide the distribution or whatever activity you are doing in a like 2-3 time. Now summers are going on, so maybe in the morning or in the after in the evening time, or maybe after 3 p.m. or 4 p.m. Because at the mid of the day it's very hot and very difficult to maintain yourself hydrated, and it's problematic for the beneficiaries also. So try to segregate the distribution or your work, and also try to segregate your staff. Don't call all the staff every day to the office, or those who are required, only those staff should go on field, not every body. The other thing is, one staff, if some material is used by one staff, he or she should not use others person workstation or the material. So keep your pen, your whatever notebook to yourself only, and try to limit the exchange of workplace and the exchange of material. Disposal of mask is also very important. That you should not like when you have to remove the mask, you have to remove like this, not like this. If you touch the outer surface of the mask, your hand get infected, so you have to wash immediately. And if possible, try to keep the mask outside your house or some corridor. Don't take it inside. The other thing is very important. If you see, I am wearing this the OT gown, and I am using this throughout the day, and I have purchased at least 3-4 sets of this gown. And I am working in a hospital or high risk area. So what I do every day in the evening, once I go to my home, I will change all these, the pajama and shirt, and put it immediately in the this surf excel or some like detergent and bucket, and take the bath. That will prevent you as well as your family member from getting the infected. This is specifically for those health worker, those worker who are working in a health setup, hospital, or in a quarantine center or isolation center, or doing some sort of high risk work. And right now is summer, so it's anyway very comfortable if you wear like simple cloth. And also don't use mobile cover. Use your use your mobile without cover, and don't bring too much stuff from your home. If you can keep your notebook, pen, everything in the office, keep in office only. Don't take everything to the home every day. Plus, even the wallet is wallet belt. If you can avoid, that is very good. At least for the next few months, when the chances of transmission is very high, and frankly, we don't know everything about corona so far. So it's better to take maximum precaution. Next slide. Yeah, so this is again same that the usually if somebody get infected with corona, like today, if I get infected, only after fifth day I will develop the symptoms of corona. So if you think that if you are exposed to corona, then ideally you should quarantine or yourself for 2 weeks, but minimum 1 week is very important. 5 to 7 days. After 7 days, if there is no symptom, you can join the work. But if you have any symptom or exposure, high risk exposure to corona, then please isolate yourself for at least 1 week and maintain this 3 feet distance everywhere. Next slide. मैनेजमेंट हाँ सो आई विल क्विकली गो थ्रू दिस सो हाइड्रोक्सीक्लोरोक्विन का बहुत सुना होगा सो वन डे आई थिंक डोनाल्ड ट्रम्प ही ट्वीटेड अबाउट दिस हाइड्रोक्सीक्लोरोक्विन बट माइंड इट all these medicine hydroxychloroquine or remdesivir or these are not like drug which can prevent or treat corona. Remdesivir is only for those patients who are critically ill, who are on ventilator. अब तो वो मरने वाला है. We can't do anything. So just give remdesivir. So in few cases there are reports that they have like the recovery, but even after recovery it's not like the fully all right. There are like significant damage already done. So remdesivir is only for very critical ill or sick patient. So any effective drug, the kind of drug we actually need is some drug which is which you take and it you are rest assured yes, this will prevent me from corona. So that is not available so far. Or some drug like antibiotic, if you take antibiotic, you know this is going to heal our wound. So till now there is no drug, neither hydroxychloroquine nor remdesivir or anything. So these are the just trial or also for general public. Don't think about that. Hydroxychloroquine is in fact ICMR also recommended only for the health worker, but frankly we also don't know that there is no evidence that how much effective it is. Right now studies are going on, but results are awaited. Only thing is this antibiotic is effective for like normal mild cases, just to prevent pneumonia. We give antibiotics. So paracetamol and amoxicillin, amoxiclav, these are the few antibiotics which we are using to manage the mild cases. Those who are anyway not going to die or very sick. So for the similarly plasma therapy is also, but is still under. So don't wait for plasma. Depend on plasma therapy. It's also for terminally ill patient, and there is no clear-cut evidence that it's very effective. Plus lots of issues, because once you take plasma, you don't know whose plasma you are getting, and there are more than 200 diseases which can be transmitted through body fluid. Plasma is type of body fluid only. So don't depend on it. Right now is focus on just on your immunity and safety. Mask and hand wash is and social distancing is much more effective than all these things. Next slide. Vaccine, as I said, so aaj tak till date the swine flu vaccine took earliest around 3 to 4 years. उससे पहले तो आज तक कोई वैक्सीन बना ही नहीं है. So even if we do work on super speed, it will take at least 1 year to 1.5 years to get some effective vaccine. Currently, more than 100 vaccine trials are going on. Only one, which is of Oxford University, is of like good quality, and the chances that it will be effective, its chances not 100%. But fortunately, they are producing that vaccine with Serum Institute India. So in UK, this vaccine will come around October. By India, in India by December end or maybe Jan next year. In a best case possible, if everything goes fine, smooth, because it's not just vaccine, we have to check the effectiveness of the vaccine and how many, like after taking how many injection this provide the protection, and what is the percentage level of protection. So lots of it. So don't depend on the vaccine, or market mein aane mein to और भी time लगेगा. If we found some vaccine, it's good, and we should try to develop vaccine like we develop for the polio. But there is no guarantee that we are able to have some effective vaccine in immediately in next few months or few years. So this is all about vaccine. So don't depend on vaccine, try to change our lifestyle. Next slide. This is again self-explanatory. There is this again in a press conference. Donald Trump said that inject this disinfectant and it will kill. Or disinfecting outside body is not going to help. The important thing is protection of your nose, mouth, and eyes. Next. Yeah, so ये भी चल रहा था कि does the only older people are getting affected? It's not like that. Older people are definitely they form bulk of the cases, but now many young cases. In fact, 6 weeks baby died of corona. 3-year child toddler died of corona. So everybody is exposed. Those who have like lower immunity, suffering from like cancer, renal failure. Pregnant women are also in the high risk category. Those who are on anti-diabetic, hypertensive, or the children with immunocompromised status with like some cancer or some other immunocompromised disease. They are like more prone to. But if you are healthy, then the chances of you, and you take proper precaution, then the chances of you getting infected and develop serious side effects of corona is very, very less. So don't be too afraid and think too much, because if you take too much tension and spend too much time on mobile phone, it will going to reduce your immunity. Because when we get tense or we have like sleepless night, our body produce lots of this steroid, and steroid lowers the immunity. So I would request that take proper sleep, use less mobile, especially in the night, because it interfere with your sleep cycle. It reduces the melatonin production in the eye, and without that it's very difficult to maintain normal sleep cycle. So healthy diet, healthy sleep, and keep yourself and your family away from this mobile as far as possible. Next slide. So this is again for the for health worker. This should be the ideal PPE thing, but nowadays there is a scarcity, plus lots of like it's a very expensive, almost 1,000 to 1,500 rupees per kit, good quality kit. So this is not for general public. This protection is required for the health worker, doctor, or the the person who are actually working in isolation setup. For those who are involved in the field activity, wearing the mask, using hand hygiene and the gloves is more than enough, and social distancing. So mask, hand wash, and social distancing, these three things are the key. And plan your work, whatever you are doing, keeping these three things in the mind. You and your colleague will be much safer. Next slide. So if you are going on for the same thing, the use face masks, disposable gloves, waste disposal is also very important. So if you are doing some distribution and many of your staff are going on field, then like the all the mask, gloves, everything should be properly. There should be one bin with cover to dispose of these material. You should not just throw away all this, because these are potential biohazard. So you keep it in a dustbin. Keep yourself hydrated. You can take these ORS packet. In fact, now what we are doing, we are giving 2 packs of ORS and the water bottle to everyone to use on field. And during summer, it's very important that you should drink at least 2 liters of water while on field. Then the proper sleep, adequate nutrition. Smoker and those who are consuming tobacco is at significant higher risk. Because of smoking, the lung capacity goes down, and corona loves the weaker lung or immunocompromised lung. So they will grow like anything. So even there are many studies now which said that the chances of smoker facing serious infection of corona is very high. So if you are a smoker, quit smoking or reduce smoking significantly. Same with tobacco also. Safety officer, as I said, there should be one safety officer or infection control officer who monitor. Otherwise, you write it down without appointing somebody to look after this infection control measure. Compliance is very poor. Don't touch unless necessary. So the one very simple thing, if you are right, you are using your dominant hand is right hand, try to do everything with the left hand. So if you use left hand, then your mind or automatically think whether we should do or not. And then the chances also, if you have to use your hand, try to use your non-dominant. So I'm a right handy, so I will use my left hand to do most of the work. Next, especially to open the door or click on the knobs of the lift. So this is the last slide. Corona has changed the way we live, and it will drastically change our. So you see, now people are adapting themselves for much longer fight with corona. So I assume be ready for many surprises in next 6 months. And I really doubtful that the way we used to live before corona is going to come back again. We have to improve our lifestyle. We have to care about nature, and be simple. Simple follow life is simple lifestyle, and care for nature is very, very important. Otherwise, because of this consumerism, even if we able to control this corona, maybe 5 year, 10 year down the line, there will be some other Maha Corona or some other novel coronavirus too will come. So thank you so much, and now I am ready to take any question.
So thank you, sir. Thank you for such an enlightening session. And I think the way that you've demonstrated how should we use the mask, how should we use the temperature gun, and how we should remove our masks and take care of ourselves while we're in the field are very relevant. So, sir, when we floated the invitation for the webinar, we received 3 questions, which are from Dr. Dhruv. Dr. Dhruv is actually our eminent HCL grant consultant. He's also a MacArthur Fellow, and he has sent 3 questions for you, sir, to be asked during the webinar. So, the first question is, given your experience of working in the slum areas and in-depth study on in-house environment as an important influencing factor on incidence of TB, do you recommend that it can be implemented in designing the COVID-19 treatment center at a similar location? Does DFI have a checklist for this purpose?
Yeah, so this is very good question. In fact, the area where we are working in Mankhurd, in Mumbai as such, we have more than 25,000 TB patients. So in all these slum, we are working in M East ward area. So TB patients are specifically, they are more prone to COVID, this coronavirus. And in fact, right now we are working. In fact, today only I told my doctor in charge there, we are planning to set up a separate ward for those TB patients who get like corona. Otherwise, if you mix TB plus corona patient with the other normal people staying in the same ward, you are going to spread the infection. And especially in all the isolation center which are closer to these slums area, and have higher caseload of tuberculosis, we have to keep separate ward for them. Otherwise, they will infect other. The second thing is we have to do this the follow up with all the TB patient to register for the sign symptoms of corona. If there is a slightest of the chance that he or she might have corona, then we have to screen that patient thoroughly for the corona. So so actually, if you ask me, the major challenge of Mumbai is because of these 2-3 reasons. The first is our slums are highly densely populated. And if you see, there are 24 wards in Mumbai, and every wards have one slum. And it's very important to keep these slums out of corona, free of corona, because so basically all our housemaid, driver, liftman, security person, they come from these slums. So it's kind of symbiotic association between the tall tower apartments mein jo rehte hain, unka with these slum people. So it's strategically located in all the, in M East Ward area is unique, where we have 80% slum population only. But these people only spread across Mumbai and join as your housemaid or as a sweeper, cleaner, liftman, driver. So it's very important. So the density is one thing. The second is high number of TB and HIV cases. These are more very prone to corona, and mortality is going to very high in these setup. And third is this diabetes and other hypertensive diseases are also in high number. So definitely these slums and slums with high number of TB required a special attention.
Thank you, sir. I think many people also had questions on the situation of the slum, especially in the Dharavi. I think your answer has also answered their curiosities. Sir, second question that we have is again from Dr. Dhruv only. So it is, in your opinion, how will the same factor influence on the spread in rural area in states like Bihar and Andhra Pradesh or Maharashtra, given the current rural housing environment there?
Correct. Again, this is also a very good question. So basically, if you see our rural area, if you see rural area of Assam is very different from the rural areas of Bihar or UP. So in Assam, I'm not much worried about rural area, because if you have visited Assam, the houses are far away and people are like, they don't construct their house just on the road. they keep at least 50 feet distance from the road, and the distance between two houses are not like very far. It's not very close congested thing. So all those estates with lower this density per square kilometer, they will manage it nicely. But the estate with high density, especially UP, Bihar, or MP, mainly in UP, Bihar, it's going to be a huge problem. Plus, urban and peri-urban area where and in rural villages like in Bihar, we have Mushar Toli. So Mushar are extremely backward category. There is a group of EBC, extremely backward caste category. So there are 22 castes included in this Mahadalit category. So if you see their houses, they are just hardly 8 feet by 8 feet, and 8 or 10 people are staying in that. So if coronavirus get transmitted to those villages, these are going to be a major challenge. Otherwise, the area with wider spread and less population density, we can manage those area well.
Right. Sir, second, thank you, sir. So the third question from Dr. Dhruv is, does DFI have any long-term recommendations for rural housing design? As both the vector, coronavirus, uh, and the first human beings are there to stay, it may possibly increase in rural areas with high number of in-migration. If DFI has such recommendations, please share it.
Correct. So this is again excellent question. In fact, in M ward 2 years back, we did this kind of a study for TB, the relationship between the housing and tuberculosis. In fact, that article also got published just 2 months back. And currently, we are working with Cambridge University on the same thing. So actually, our focus till now was on tuberculosis, but with this change, in fact, it's you will be happy to surprised to note that on 26th of March, 26th and 27th March at Mumbai, we have booked that one 5-star hotel in Mumbai to organize the same thing, the housing design, how we should change the housing design so that the cases of TB and other airborne diseases can be reduced. And that meeting got cancelled, workshop, because of corona. So now we are thinking of including corona also in this. So study is going on, and hopefully in next 1 year we will come up with some it is done in partnership with Cambridge University plus 2 universities from South Africa. So South Africa, UK, and India. It's a 3 multi-centric trial which we are doing.
Right. So, sir, there is one very controversial question which is linked, which has been asked in various forums. Some people have even emailed us to ask it anonymously. The question is, sir, that whether coronavirus is a natural virus or is it a man-made virus?
So, see, frankly, if you ask me, till now it behaved like a natural virus only, but the way it is spreaded, and the scientists are struggling to develop any vaccine or any antidote of this virus. And with China, they keep still they are not open to the like full investigation by international agency. So if you ask me, it's a 50-50. There is, I can't say that it's 100% natural, and nobody can say. In fact, our one of our minister, Mr. Nitin Gadkari, he is one of the most sensible minister of our current this group of minister, and he also said in an interview that it might be a lab made or non-natural virus. So I think it will take some time to answer the like fully. With China, everything is very secret. So because the way it is spread and the infectivity is very high. There are chances that it can be a biohazard type material, and accidentally it got leaked, and so only time will let us know that the correct answer of this question.
Thank you, sir. So one more question which has come is that now it's the time where people are going to sow rice and reap the rice paddies. So, sir, what is the kind of can it spread in that atmosphere where you're standing in water, and you're doing the rice work in the field? Can it spread during that time, and what is the precautions that the farmers should take place while they're working in the field during this time?
So the two things, the by and large farmers and rural area are relatively safe if they maintain follow all these three basic things: social distancing, hand wash, and the mask, and avoid gathering. The other thing is, it's very important right now to focus on agriculture, because right now we have around 80 million metric ton of dry ration at FCI go down. But suppose if this year monsoon is not good, or then we, in worst case scenario, we might face food crisis. And it's definite that many countries, especially in African country, they will see very big food crisis. So it's very important to focus on agriculture, keep our farmers safe. As such, in the rural area, there is not much worry, and there is no evidence that corona is transmitted through water or sewage. There are studies going on, but now there is no evidence that, just like polio, this corona also is spread through sewage. It's not like that.
Right, sir. So one, I think, last question that we have for you today is about bats. So people are actually, there is a question that people are saying that it's this virus is born out of bats, or it's being transmitted out of bats, and they're killing bats. And bats are very important for ecology. So, sir, what is
Mhm.
your comment on it? Is it a bat-borne disease, or should bats be held responsible, or should we kill or not kill bats?
No. Killing bat does not make any sense. In fact, it's not bad mistake. In fact, the many reports have come that even in China, not many people eat bats. जैसा वो WhatsApp पे और इस पे चल रहा है वैसा नहीं है. They also, and but definitely bats are linked with this corona. Even Ebola also bats are linked. But it's not directly from bats to animal. There is one intermediate animal also. So killing bats is not at all recommended. Eating bats is also not at all recommended. We should avoid encroaching into the forest and like mindless development, and destroying the natural habitat of these animals. Do you know, can anybody answer, do you know every day how many species are getting extinct means total eradication? You won't find any every day globally. Can anybody suggest?
Yeah, can anybody suggest that? I don't know. So,
You don't know, na?
no, so I don't know. Maybe anybody from the audience, you can write in the chat box.
This is very important, because we are worried about Homo sapiens. We are also one species, na, like others. So, agar dekha jaye, to we all have equal right. So we are worried about ourselves. Oh, human beings are dying, and but anybody. So yeah. So one
So
is
there are
saying
two
150.
replies. Actually, there are three now. One is from Arpit. He says 50 species per day. Ravikant says 150 species, and Aruna says 100 species.
So it's 200 species. Correct answer. So almost 200 species are getting extinct every day because of us, because of all of us. The way we are using, and like everything, the plastic, and actually, if you go to the main point is, we are too many. Earth has already crossed the limit of sustainability. Earth can't sustain 7 billion people. In fact, Mr. Harish Hande, who is the Magsaysay awardee and head of Selco Foundation, he once said that if we want to develop the lifestyle of all the citizens across the globe to American standard, we need earth three full earth of resources. If we have to develop at European standard, we need 2 earth of resources. So we have already crossed the limit. So so we have to seriously think about the population control. If I say bluntly, we are too many and we are destroying this nature. And if we don't reduce and my if you personally ask me, my idea is to United Nations should plan and keep a tab on the number of population based on either on area or whatever limit, so that every country 50-year or 100-year down the line try to achieve that target and focus on family planning and other thing. Otherwise, like if we keep on producing like this, in few year by 2050, I think we will 2050 or 2100, we will cross 9 billion. So kahan rakhenge unko, kahan housing, whatever housing you will develop, where is the land? We just have 3% drinking water, and that is also polluted. So these are the basic questions which nobody wants to discuss, because if we start arguing this, then all the oil industry and big thing so the nutshell is we have to reduce our population in a stepwise manner in next 50 to 100 years. Then only otherwise be ready. In last 20 years, there are more than 10 big outbreak of diseases like this. So corona is just one. I'll give one more interesting. HIV HIV is also like coronavirus, RNA virus. Yeah, it got like we discovered it in 1984-85. आज कितने साल हो गए? 35 years. Are we able to develop vaccine for HIV? No. So why we are hopeful that we will get a vaccine? And yeah. So we have tried, adjusted our lives to live with HIV. So similarly, we have to live with corona, and we have to change the way we live. And the जो गांधी जी का ये है ना, the simple living and love for
I
nature,
think.
we have to do and control. Otherwise, difficult. Thank you so much.
Neha, if you permit, can I ask one question? Anshu, this side.
Yes, Anshu, then after your questions, we have two very pertinent questions, which will be our last questions, because I think
Yeah,
they're very important.
sure. So, sir, I have this question because in news also I have seen that in Italy, when the postmortem was conducted in the patients who died because of corona, they found that the major cause of death was thrombosis and not hypoxia. So, sir, every day the symptoms are being changed of corona. So, will the use of ventilators, like the demand of ventilators, will go down because people are dying of thrombosis as of now? So, what is your views on that?
Correct. Very good, excellent question. So basically, initially, as you know, it is spread like a wildfire, everybody, and we have not initially, we did not have that much evidence. So now, after, in fact, we were not doing autopsy earlier. So now we have started doing autopsies, and research studies has increased significantly. So it causes thrombosis, and that's why you are correct. There are many articles which suggest that even ventilation is not very helpful. And but because many patient goes and required and critical phase, and they require ventilation, that's why demand for ventilation is high. And as a person, as a doctor, what I would want, I would try to save my patient till the last breath. So I'll try everything. We put ventilator, we give high pressure oxygen, but thrombosis is also happening. And if and that's why even in the recovered patient, we are reporting many like the neural deficit and psychological changes. So thrombosis is causing affecting brain also, as well as the heart. Myocarditis and MI is also reported because of corona. So you are correct. Ventilator is not the only solution, and so thrombosis, oxygen, everything is required basically. We can't say that evidence suggests that ventilator are not so helpful, so we will stop using ventilators.
Thank you, sir. So one last question, and then we will hand over the. Then we'll request Nidhi to share the vote of thanks. So the last question is, sir, that a lot of people are in a situation where there is scarcity of water, and they do not have either soap, or they may not have access to a 70% alcohol-based sanitizer. So in such a situation where these three important elements, which are meant for hygiene, are missing or not there, how should one protect themselves from from this infection?
Correct. So regarding water, see, water is definitely a big problem. You remember the last year in Chennai, what was the situation in the summer? It was totally out of water. So water is again separate developmental issues. We can discuss in detail later. This is the precise reason we have not focused on the basic sanitation and provision of other developmental deficit is so high that we are struggling to control corona. Even cities like Mumbai, which has like 25,000 crore rupees budget just for Mumbai. So the second thing is sanitizer का तो अभी business चल रहा है. I don't think so sanitizer you can just throw away. Just use simple life wire 5 rupees का जो soap आता है ना, that is more than enough. Keep one soap case and one soap with you at in your bag or pocket, whatever. And soap is equally and even much more effective, because if you use hand sanitizer, in fact it is recommended that after I think fifth or if you use 5 or 6 times the sanitizer, you have to wash your hand with the soap and water. So soap and water is number one and most important thing than sanitizer. Sanitizer to it's more for our like the health worker doctor, where they have to go and see lots of patients. Even even for the doctor, if possible, they should wash hand. Hand wash is any day much better than the best quality sanitizer you can purchase.
So thank you so much, sir. Today's session was very informative, and we did have a lot of questions that have been answered today, and we are grateful that you took out time. I can see that you're still in your scrubs. You're possibly still at your hospital working with patients. So thank you so much for your time today. And now I request Nidhi to please share the vote of thanks.
You can send any question, relevant question on email also. I will reply, no problem.
Sure, sir.
It's such a pleasure hearing you again, Dr. Ravikant Singh, and thank you to the entire Doctors for You team there, as well as HCL Foundation team for organizing it. And the attempt of HCL Foundation Academy has been, to kind of get the most relevant topics to larger development fraternity out there, as well as our own beneficiaries who look forward to exchange of knowledge. And on this academy, there are some practical courses also which have been launched basically for enhanced understanding, and through that have high quality programs delivered in the field. So the idea behind HCL Foundation Academy is predominantly that how do we really have higher capacities built amongst the ones who deliver programs, such that the larger quality of developmental programs goes completely at a different level. At times we miss the basics, and I was hearing you out from the beginning, and in how simple ways you have really explained, starting from COVID-19 virus, and the larger uh, basically prevention aspects, and also making it very clear that while we are hearing so much and there's so much news around it, it is lifestyle. And also you have made it very clear that it is in and it's going to stay for some time, maybe longer, and there's so many questions in future which perhaps we don't have an answer today, but then what is it that we need to today was very do today was very clear from your session out there. I know more than 300 people, I saw in the end that they were looking to enter the room, and that's our maximum capacity in this classroom. On purpose, we did not go for a higher level classroom because, people who enter should be the real learners. But then this was also being relayed on YouTube simultaneously, and many people were watching. I'm sure the myths that people have been carrying around the COVID-19, the novel coronavirus. It was an opportunity for them to actually break those myths and continue to work with simple precautions like hand washing and using a mask, and that seek early medical care, as well as focus on current work, because it's not something that we stop everything else and we just focus on one thing, because then whatever developmental work that we have done since independence, everything will come, everything will become neutral, or go back, it will reverse itself, and the other issues which exist in our country. And it has taken a lot of hard work for us to come all this way, and on top of that we have corona now, the COVID pandemic. So we got to deal with it, and that's what was very clear in your message, and yet continue on economic growth, as well as dealing with other issues, be it tuberculosis, and be it, we have eradicated polio, but then, we can't afford it to come back. So we have to continue with our regular healthcare programs as well. So I can't thank you enough, Dr. Singh, for such a simple way of communicating, despite coming from medical field and being on ground all the time. And we look forward to a continued association with you, and as time permits, have you more on academy, along with your team, off and on. And thank you so much on behalf of the entire ETSIL Foundation team, ETSIL family, as well as all the participants who attended the webinar today.
Thank you, ma'am, for giving me the opportunity. Thank you.
Pleasure is all mine. Thank you so much. Thanks. And we will be, I think Anshu needs to open some kind of a poll, and from there back to the facilitators here. Thank you.
Thank you, ma'am. Now I request Anil to please launch the poll.